This is Mommying While Muslim, recorded live and unedited. Watch as Zaiba and Uzma record their podcast, see their reactions, and find out for yourself what all the buzz is about.
Assalamu alaikum, everyone. Welcome to another episode of Mommyingwhilemuslim podcast. This is Uzma Joffrey.
Hey, Assalamualaikum. This is Salat Zaidi. How are you today, Uzma?
I am good. You're our special surprise for today because I went on to lives and I was like, we have a special surprise. Solat's coming back. So I thought that was very shareable. How has your week been?
My week has been okay. What day are we on right now? Are we on Monday? Yes, it's been great
We're
so
Monday.
far. You know,
It just started. No, I meant last week. You
how's
had a
your
busy
week
week
been?
last week. Mine's been good. I have been
Um,
binging. You are our lovely teammate from the UK, and I have been binge watching Call the Midwife on Netflix, which is based on
do you
post-World
like
War
it?
II midwives in the East End of London. And it just, like,
That's
I
where I'm
started
from.
season one
Yeah.
from the East End.
Mm-hmm.
Oh my God, I love it. I love it. Like,
Yes,
I'm so
that's what
happy. So it's in the
I just
neighborhood
had
of
to give you the
Poplar.
call out right there. Yes,
Okay,
it's
I
not
absolutely
far. I
love
was
it. The
born
show is
maybe
worth it.
20 minutes from there.
Oh my gosh, that's so small world. Yeah. So you probably know all about it. For me, it's like a cultural experience, and more so, it's so educational and affirmative because the whole show is about women coming together in, oftentimes the worst of circumstances. So I have some friends who, have more delicate sensibilities and they can't watch all the gore and grimy, like the hard parts of post World War II anywhere in the world. And so, for somebody like me, where blood, guts, and like, the socioeconomic problems that come in certain parts of the world, I've seen it, so it's not as troublesome. I love the womanhood, sisterhood that it talks about. And so I started season one on September 25th, and I'm currently on season 8. So it tells you it's a good thing I am Muslim because otherwise I'd probably be addicted to drugs and alcohol. So currently it's Netflix.
I just have one question for you. If you're okay with
Sure.
blood and guts, what's with this aversion towards horror movies?
Oh, I'm just a chicken. Yeah, I'm just a chicken. I know you're trying to get me to watch a scary thing, but I'm just such a chicken. I can't because I have to sleep with the lights on for like 3 weeks and my husband gets mad. He's like, I'm right here. No ghost is
Okay.
going to kill you. But, I still need the lights on and then, he can't sleep. So it's a problem. So you
And
ready for our
my other
soapbox today?
question is,
Oh, go
I
ahead.
do, but I just have one more question for you. So, with the show, do you have a problem with understanding their Cockney accents, or are you okay with that?
Totally. I'm so missing subtitles. I wish there was subtitles.
Oh,
So it's good. I can rewind it
okay.
and just keep listening. But yeah, there's a lot of times I have no idea what they're saying because Cockney
Okay.
is hard.
I just
But my
wanted to ask
understanding is
that. So,
Cockney will be gone. Yeah, Cockney is disappearing, which is the accent of the East End of London, is going to disappear with the next generation and be replaced by a mix of Indian, West Indian, and Caribbean accents. I think there's another name for that, but I don't know what it's called because I've been reading, obviously, now. I'm like, oh my gosh, all about the East End of London. So
I wouldn't be surprised. It's very, multicultural out there. But yeah, send me
very
the article
diverse.
too. Actually, there'll be something that yeah, for sure. But how, what's on our soapbox for today?
So our soapbox for today, and by the way, Miss Zeba was busy doing a paper for her graduate program. So that's why she can't be here for our special pajama party. So, Solette, thank you so much for introducing the soapbox. And, I was going to talk about POTUS and everything that's going on with the COVID infection that he has. And, there's a lot of conspiracy theories and a lot of suppositions and, um, assumptions about what this means for our country and what's really going on. Ultimately, I don't think it matters. I think what is interesting for those people who support him, I found, it kind of runs the gamut. There's Muslims and non-Muslims that run the gamut where everybody's like already clicking their heels and dancing, including me and my family. And people are like, oh, well, then you don't really deserve to be in the profession you're in because you're celebrating somebody dying. But I don't believe anybody cried when Hitler died. So, I mean, if you did, then you probably are evil too. So, yeah, I don't know. Comparing him to Hitler, maybe that's extreme and maybe that's too on the political spectrum for me. So I won't do that. But what I did want to point out is among all of the ironies of the situation, let's talk about, everybody who loves this person because he doesn't take a salary from the United States. So I don't think we've paid the Secret Service for many, many months now for all of the detail that they have to provide to not only POTUS, but his family members, including his children, who are somehow all plugged into
Hmm.
government somewhere. I believe they call that nepotism in other lands, but in America, we call it America. So incidentally, our parents escaped or left their countries because of this kind of nepotism that occurred over there, but now it's here. So, in any case, um, the Secret Service isn't being paid because we can't afford to pay them as taxpayers. And then our president paid $750 in taxes and is getting really expensive and good care, and it's not equitable, right? Because the average American, the 200,000 Americans who have been infected or died of COVID in our country, didn't get that equitable treatment. They're certainly not going to get anything from Regeneron, which this is the ultimate irony that I wanted to point out on the soapbox today, because this is all we have time for. Regeneron is the pharmaceutical company that is providing the experimental therapy that POTUS is getting. And I love that a lot of their research is based in stem cells. And where do we get a lot of our stem cells? From fetal tissue. And who is the Supreme Court nominee currently? Former, or I guess she's current because she hasn't withdrawn her professorship at Notre Dame University, a conservative Catholic university in the United States. And historically, they don't love fetal stem cells. So I think it would be really, really funny and
Hmm.
ironic if somebody gets fetal stem cells, but the person that he's nominating would actually say that's not okay, you know? So that was kind of my soapbox. I am totally sick of people talking out of both sides of their mouth. If I'm guilty of it, please call it out to me. Like, I would like to have the information in front of me. Like, oh, did you know that you took money from so and so, which is like anti LGBTQ or is pro stem cell research, and you don't agree with such and so forth? And that has happened where we've been called out on certain alignments that we had. And so we made sure to disalign ourselves. And I just, you know, I wanted that to be my soapbox for today: stem cells and POTUS.
I appreciate it. I love the way how you tied
Irony.
back your, your medical background with POTUS and irony. It's brilliant.
Yes, we
So
can because they're
talking
all
about
related. So,
talking about medicine and health, I am super excited that we're going to be kicking off the women's health um, series with talking about endometriosis. I think that's a foreign word for most people. The only reason I kind of know about it is because two of my sisters suffer from it. But even then, I am
oh,
so excited to be here to understand more. So we
hmm
have, we definitely need better and more, information on the subject. And we have our expert, Dr. Zaiba Ahmed. She is a board certified physician in PMNR and was born and raised in New York. She's already told me she doesn't follow any sports, so no giant hater here right
no
now.
use in asking.
And and she works in Manhattan, specializing in pelvic rehabilitation. She joined Zaiba and Uzma back in February to talk about pelvic pain, and since then she's been working hard, surviving the lockdown in New York, and she's back to tell us about endometriosis, which as we've kind of said, there's so much more to learn about. It currently affects about 10% of the women in the world, and you know, let's face it, there's a lot of us, and so we definitely need to understand more about it. So Welcome, Dr. Ahmed.
Assalamualaikum. Welcome to the
Assalamualaikum, ladies.
podcast.
Thank you.
Islam.
Thank you for having me back. I'm excited
So,
to be
for
here
those
and to
people who
teach you
didn't
guys
listen to
about
our
endometriosis.
absolutely, there were probably some people who haven't listened to your awesome episode, even though I think we re-released it recently, that maybe didn't hear your episode on pelvic pain, and so they don't know your mom's story and a little bit about you. So, can you share that with us again?
So I am a mother of two, and I classically, a lot of people think, well, you're a mom, you have a baby, you're going to start peeing yourself when you do jumping jacks. And after my first baby, I wasn't leaking or having any of those issues. After my second, because they were so back to back, I didn't really do anything in between. Um, and so I started having some urinary leakage, which is totally normal. It's called stress incontinence when I would sneeze, when I would jump or work out. I then was doing my mommy job, which was part time, and I was introduced. I had an opportunity to do pelvic rehabilitation, and just learning about the fact that there is no rehabilitation postpartum, and even for anything pelvic, there is no rehabilitation. So I was excited to join this field. And one of the biggest topics that I see now is endometriosis. So I'm excited to talk about it.
Well, what do you think, Sola? I think we should just give her the floor and be like, tell us everything about endometriosis. Because here's my a brief summary of my practice. When people came and told me they had endometriosis, I just took them at their word, or I referred them to OB. But there was no kind of pelvic rehab was not even something I'd heard of until February when you came on and you educated us on that. And I went through all of the medical school and all of the training and had never heard about it. Now they're coming out of my ears because I contacted like three of them locally after you and I talked. And since then, they have become friends. So I'm really excited. But, you know, I don't know, Solat, you said you had some experience with endometriosis. I haven't personally had anything outside of really painful periods and a brief stint of what I think was infertility. But like once the ball started rolling, they just started coming back to back, and then I had to stop gap that. So I don't really know if I have it or
Yeah.
not. But Sola, do you want to tell us a little bit about your experience with it? And then Thayeba can give us the facts.
So my experience actually has been through my sisters and see the pain that they go through, and a lot, like one of the sisters had really bad fertility issues. She had multitude of issues, but it was really hard for them to place the finger on exactly what was causing like her pain, what was causing the fertility issues. There's it, I grew up in England, and the NHS, for some reason, the diagnosis or on how they do endometriosis isn't that clear. So that's one of the common things I've heard from my sisters, and just the pain. And I've had sisters who we've had like dinner conversations where we've been like, will having an IUD help me with the pain with with endometriosis? Or my other sister saying, I stopped eating wheat, that really helped. So I mean, this, to be honest, a lot of it's for trial and error. And I feel like with a condition that affects so many women in the world, there's got to be better guidelines. And again, it may be different in the US. I'm just talking about the experience I had in the UK.
No. So
It's
in
all
the
yours,
US,
Thayeba.
it's basically the same. Basically the same thing. I mean, I have
Oh
women
dear.
who are educated and know every single thing about it. I have women who have no idea about this diagnosis. I will tell you, the first thing I saw, the first time ever in my life, I saw a woman 60 years old. And I see about 40% of my patients are endometriosis. So I see a lot, at least 300 patients with endo. And
Wow.
this woman was 60s, and she was diagnosed 40 years ago. Now, can someone guess what color her skin was?
Isn't
Anybody?
it white?
Anybody? White.
She was
Why
this.
would a white
Yeah.
woman get diagnosed when she was in her 20s? When if she was black, guess when she would have gotten diagnosed? Not
Probably
yet.
way later.
She wouldn't have been diagnosed. Yeah,
Oh.
she probably hasn't even been diagnosed yet. Only
Mhm,
white
mhm.
women were diagnosed back then because only white women could get fertility treatment because so much of infertility is due to endometriosis. So
Mm.
just knowing that there is a huge population of endometriosis that goes silent for so many years. Because if you think about it, when you are taking hormonal oral contraception, it actually will suppress the symptoms, sometimes suppress the symptoms of endometriosis. Now, here or in the UK, I'm sure everyone, when you're Desi or you're Muslim, doesn't really matter if you're Desi or you're Muslim, there is a taboo around birth control. And so the
Right.
reason why so many of our girls are not diagnosed with endometriosis earlier is because we're just expected to live with the pain and deal with it, take some Motrin, use a heating pad, um, and then go on with life. But Caucasians are usually given birth control when they're 18 years old. And so from their teenage years through their 20s and through their maybe through their 30s until they start, talking about having children, they may finally come off of the birth control and now their symptoms are worse. Now, I'm not talking about everyone. Birth control doesn't work for every single person with endometriosis. There are so many different ways that endometriosis presents clinically. You could have terrible grade 4 endometriosis on the inside and have no symptoms on the outside. And you can have insane symptoms and have no endometriosis when it's diagnosed laparoscopically. So the only 100% gold standard way to diagnose endometriosis is by having a laparoscopic surgery, basically going in and looking for endometriosis. Now, endometriosis is not the endometrium, which is really important little distinguishing factor that people should understand because it is not the tissue inside of the uterus. It's actually tissue that looks like it now outside of the uterus. So we can talk about myths now or later, but that's one of the reasons why a hysterectomy is not going to treat endometriosis because endometriosis is not in the uterus, it's outside.
Mhm.
And as Solat was saying, 1 in 10 women in the world has endometriosis. So that's about 176 million women in the world that have it. And so essentially, you can't die from endometriosis. It's not like a cancer, but it's essentially a benign tissue that continues to grow. And if you burn it off with an ablation, which is a procedure where you can go in and burn it, it can grow back. And there is a recurrence of endometriosis. So the reason why it takes so long for women to get diagnosed is one, you need a surgery in order to definitively diagnose it. And two, there is such an overlap in the symptoms of endometriosis. So you can present with GI symptoms and present with urinary symptoms and present with GYN symptoms. You might not have all of them. You might only have a few of them. But if you and a lot of people assume, well, it's all month long. It's not just with my period, so it's not related to my menstrual cycle. But unfortunately, endometriosis can be all month long because it's not like the tissue just goes away, it stays in your body. And that's why 60-year-old women are still presenting with symptoms 40 years later because even though they were diagnosed, they may not have had the endometriosis removed properly, or it's going back if they did have it properly removed. And ironically, back to your soapbox, endometriosis is found in 9% of female fetuses. So it's genetic.
Mm,
And the previous, you know, theory was that it was actually due to retrograde menstruation, which is now since been debunked. It's actually genetic. And so Salat, your sister, your mom, maybe, your aunt, maybe, it does follow some lineage. So we're always asking our patients if it's, in your mom and your sister, tell me, did anyone have hysterectomies? Because a lot of people will say, yeah, my mom had a hysterectomy, but I don't know why. Like it's a normal thing it's to have a hysterectomy. But a
hmm
lot of times, you get to a certain age and you might still be having heavy bleeding, but if you're past having children, a lot of GYNs will just say, let's do a hysterectomy. And if you do a total, oophorectomy too, there goes your hormones, there goes your problems. Now,
hmm
does that mean the endometriosis is gone? Nope, it's still in there. But, a lot of people are at that point living with what the symptoms they've had their whole life and they're okay with it.
So what
So
I'm
I could
hearing
keep going, like
is the
literally.
tissue. Oh yeah, no. We're gonna get some. I'm gonna get a question in, and then Salat's gonna start the myth busting because I think, or introduce the myth busting, so you can do it because I think that part's gonna be really fun. So what I'm hearing is that the problem won't go away with the total hysterectomy, which is again removal of the uterus and the ovaries, because there's potential for this endometrial like tissue being like on your colon, attached to the abdominal wall, anywhere else on your intestines, causing this pain. So, what I see in my practice a lot is my little old ladies who are now being diagnosed with IBS because they have this, diarrhea, constipation, but more commonly diarrhea. And what I'm hearing is that this tissue, which even though it's not hormone sensitive, may be, tickling or irritating those tissues, even infiltrating into those other organs and causing a problem there. So what are you going to do? Just keep removing organs until the symptoms go away? No, it's really about finding out what the problem is early on. Early diagnosis leads to early treatment, but I'm always like a pound of prevention, but this is not something that you can prevent, especially if you have a genetic disposition to it, it sounds like, right?
No,
That's too
but
bad.
the important thing to
Sorry,
understand is
ladies.
that endometriosis can turn into ovarian cancer. And so that's where,
Oh.
like, if I have a patient who says, well, I don't want children, so I'm not at risk of fertility problems, and my endometriosis pain is only the first 2 days of my period, and I can manage pain with sex with dilators and pelvic therapy, and I'm a little constipated, so I take some like they figure out ways. But then I'm like, okay, well, what about the risk of cancer? Do you want to do it now? And some of them are like, nah, I'm okay, I'll take that risk. So I mean, there's a lot of quality of life issues like peeing, pooping, sex,
hmm
pain every day. I mean, fertility is obviously the big one.
Right. When you're young, but then when you're older, obviously ovarian cancer, by the time you find it, it's too late because they're already stage 4, right? They've got the distension, they've got metastatic disease all up and down the inside of their walls, and it's too late at that point. So, if you could just explore the ovarian cancer risk being higher and endometriosis a little bit, and then Salat will introduce myth busting.
Well, there's not a ton of of studies, but we just don't know how much it turns into it. So, a lot of people are like, well, endometriosis isn't going to kill me, right? So I don't need the surgery. Well, it's not going to kill you, but if it does increase your risk of ovarian cancer, then it might be something you want to look into, especially if you have a family history of it.
Okay, I see. It's just a good thing to keep in mind because I know
Wow.
there's ovarian cancer in my family, and now I'm like, oh gosh.
Oh, sorry.
I know, right? Great. Go ahead, Salat. Let's bust some myths.
Before, yeah, before I bust the myths, I just had a couple of questions that I was kind of confused about right now. Is that I understand that you know there's barriers when how to screen for to find out that you have endometriosis. If you before that, apart from the painful periods, what other symptoms are there? Because obviously this gives me like concern, because especially within the South Asian culture, you you just have to suck it up. Now I'm thinking about it, like I had aunts that passed out for period pain. I have half my sisters have endometriosis. I probably had it.
That's not normal. That's not
So
normal. No, that's not normal. And
you
you
thought it
didn't
was
just
normal.
have it.
It was like freaking
It
out,
doesn't
like
just go away. So when people say, "Oh, I had endometriosis and now I'm cured because I had the surgery." No, you still have it. It's an inflammatory disease. It doesn't go away. It's there. Um, you can classic. You feel like there's something around a barbed wire around your abdomen during your period, but not necessarily limited to your period week. It could be 1 week, it could be a few days after your period, end of period, it could be a few days before, it could go 2 weeks, it could go 3 weeks, it could go 4 weeks. You have possibly pain with intercourse. Why? Because people with endometriosis tend to have pain all month long, so they're clenching their abdominal muscles, which then are attached to their pelvic floor. So now you have tight muscles. So when in heterosexual intercourse, if he enters through he's going to hit superficially and then deeply, and so that could hurt. You can have urinary frequency, urgency, burning with urination. Um, I hear more chronic constipation. And just because you poop
Mhm.
every day does not mean you're not constipated. You can have bowel movements that look like little pellets. And you can also have that, some diarrhea, some constipation. And that's where a lot of people get diagnosed with IBS, because they're like, oh, you have abdominal pain with some diarrhea and constipation. Sounds like IBS. So when I see a 20 something with that diagnosed, the first thing I ask is, what are your periods like? What is your mom's periods like? What are your sister's periods like? What are your aunt's periods like? What about sex? What about, urination? You could have pain in the back, abdominal bloating, also known as endobelly. Do you ever look pregnant when you're not? And not just after eating a meal. Like, do you
okay,
actually
I was gonna
wake
say.
up and you look like or your belly is like, I mean, I see pictures of if you're ever curious, just Google or hashtag endo belly. There's tons of it. Do you have pain in your groin? Do you ever vomit because of the pain? Do you ever have to miss school because of the pain? Are you unable to go to work because of the pain? Are your symptoms, all of these symptoms, worse when you have your period? Um, Fainting, not normal. Fatigue, not normal. Tons of patients have migraines. So it is not just like a one system disease. It is like a multi total body experience. And, I really do feel that's why I'm so passionate about this, because could you imagine living that like all the time?
That
Right.
makes me feel terrible for a lot of my friends and probably like with your sisters too, because I had friends who had this where we were running them home from like university because they were like barfing in the auditorium or whatever. And it was just not like they're on like narcotic drugs and whatever because the pain was so unbearable. And I think we've all had those situations. Like Solat was saying, like we were taught to like grin and bear it and just suck it up, buttercup, like 4 Advil out the door. Like you're not missing school, you're not missing work for this. But aside from the barbed wire, I can say that I know I've had these situations where there's pain that's not necessarily pelvic pain that I'm having, but kind of wrapping around the body related to either ovulation or the period, which I will say has gotten better since I've had children and since I've done anti-inflammatory foods. So I think it's a good segue into going into the myths. What do you think, Sola?
I think that's great. So I'm
Okay.
actually adding
I
my
think you
first
had an
question myself to the
anti-inflammatory
myth.
question. There you go.
Um, the anti-inflammatory question. I think you're gonna have to
Yeah,
take
I
that one.
thought you had one in there.
I'm
Somebody
having a
sent you
brain
one.
blank. Yeah, I
Somebody was
Never.
asking
two.
about, yeah,
No, go ahead, Uzma. I'm
go
actually
ahead.
having a brain blank right now on that question.
Oh, okay, okay.
No,
There was a
Uzma.
question,
Yeah.
and I don't know where it came from, but Salat had mentioned it. It came from, do anti-inflammatory foods actually help control the symptoms associated with endometriosis?
So because endometriosis is hormonal, a lot of foods like soy, it can increase the estrogen, right? So,
Right.
well, when I talk to patients about diet, there's a ton of diets you can try. You can try doing dairy free. You can try doing gluten free. I mean, God bless all the people who are gluten free. I don't know how they survive.
It's hard.
You can try I mean, so taking out all of the meats that are not necessarily organic, that are have hormones, as much as you can help patients, obviously.
Mhm.
So, my friends who are vegetarians are like, wait, so that means no tofu, like no more edamame, it's all over. And I mean, unfortunately, if those things are flaring you or
Yeah.
triggering you, yeah, then I think you have to really limit it. Um, you know, an anti-inflammatory diet, including, a lot of herbs and turmeric and all of that is great if you can do it. And obviously for the patients, there are some supplements that I'll talk to them about. There's one called Semaine. It's funny because the number of things in it, like ashwagandha root and vitamin D and magnesium, they're all stuff that I tell patients to do individually, but they've created this like huge, it's kind of like the Nutrafol for the hair where there's like 40 ingredients that are herbs, but this is for menstrual
Mm.
cramps. And I mean, it's one of those things, they like figured out how to do it. It smells terrible, but it actually helps people get all of the supplements in one. It's not even one pill. You have to take like two in the morning and two at night. So it's still a lot of that
Yeah.
smell. But you know, it's
So,
it's
Uzma,
one of those things.
apologies.
Like if you a lot of people
Yeah.
No, I said
No,
a
go
lot
ahead.
of
Sorry.
people a lot of people will really try to manage their endometriosis without like hormonal, like birth control. They'll try to do it with diet and therapy and conservative treatments, and it works for some.
Okay. Go ahead, Salat. You had
Yes,
something?
that was. I was just gonna. Yeah, yeah. I was gonna say now. Come back to me what you meant by the anti-inflammatory foods. I just didn't realize that bread was one of them. So I know I mentioned at the beginning of the
Yeah.
conversation, but yeah. So that, again,
Hmm, hmm.
I feel like just this is a really informative conversation where there's so many things that I'm hearing from like both of yous right now that I've kind of always known, like take ashwagandha, take vitamin D, all these things, like these medicines that I take separately every single day. No one actually kind of explained to me that the whole reason why I should be taking this, because a lot of the symptoms that you're talking about, I have them, but I've had kids. So my question to you is, is it myth or truth that can you not have kids if you have endometriosis?
So that's a myth. Obviously, it really depends on your age. So whenever I have a patient, whether she's 16, whether she's 22, whether she's 35, I always talk to my patients about infertility. Endometriosis is an inflammatory disease, so it can make it difficult for an egg and a sperm to fertilize, and it can make it difficult for it to implant in the uterus. So you can get pregnant, and it's that's not it's a myth that you can't get pregnant. You can definitely get pregnant, but you have to think about what you're working with. If the endometriosis has been brewing in there for so long, and it's basically creating havoc in your pelvis, it's going to be hard for that implantation and to carry a pregnancy. That brings me to myth number two. Um, does pregnancy cure endometriosis? No, because like we said, it's an inflammatory disease. It doesn't cure it. Will it possibly make your symptoms better, like Uzma said, yes, there is a good chance that it could, but there is no like definitive proof that it will. So a lot of people with bad endo actually feel better when they're pregnant, but then they could go straight back to feeling terrible after their pregnancy. So pregnancy is not a cure for endometriosis in any way. Hormone treatments are also not a cure for endometriosis because hormones, they can fluctuate. There's so many different hormones, and we also have to know more about your endometriosis, which you can't do without pathology. Whether your endometriosis is estrogen dependent or progesterone dependent. So you try different pills, you see what you can tolerate, and depending on what you can tolerate, that's how you decide whether it's worth it for you. And for a lot of patients, I will say birth control could be a great, great resource, which is why it's so important that we have access to birth control. And in this current governmental crap show that we're going through now, employers now have the right to decide whether you get birth control or not, which is absolutely insane to me. But anyways, back to some other myths. Yeah, endometriosis is not just a painful period, and it is not just limited to menstruation. So a lot of people are like, "You're too young to have endometriosis. You're 27." No, you can have endometriosis when you're 13 years old. You can have endometriosis till you're 60, 70 years old. It doesn't matter. There's no like age restriction since now we know it's in fetuses. Um, and yeah, pregnancy is not a cure. So I think we said most of the major myths. Hysterectomy, right? I said
Well,
that. No
I do want to
hysterectomy.
hysterectomy you did talk about. I do want you to move your camera so we can all see the beautiful t-shirt that you made, because I think part of your myth busting, what was important about it was employers saying, yeah,
Okay, I don't
employers
know if you can
telling us
see.
what drugs we can and cannot have. We dissent. Vehemently dissent. So, and Thayaba made this t-shirt.
Yeah.
So, good
Yeah.
job
So
for her. I know
Awesome.
Sola appreciates it because she also uses the cry cut and knows what to do with that. What I'm concerned about is those listeners who are saying, okay, well, if surgery doesn't cure this, if there's no definitive cure, because they might have to go in multiple
no,
times,
no,
and every
no.
time we open up your belly, oh, go ahead. What did I hear wrong?
Well, ablation does not cure it. Surgery does
Right.
not cure it. You were right, but a proper excision can really reduce the recurrence rate. So the recurrence with a excision surgery is like 8 to 12%, somewhere like that. But a recurrence rate
Okay.
with an ablation is like 80%. So
Oh, wow.
that's the problem. And the barrier is with endometriosis is that not everyone can afford to go out of network or find a doctor who exclusively does excision, because even the American College of Gynecology, and so a lot, even I see patients who come from England to the US for this. Well, pre-COVID they used to, or I'll do telehealth with people, and it's so hard to find a surgeon who will do excision and not just do ablation,
Oh,
because the coding is the same for an excision or ablation. So doctors don't want to be in network and spend 3 hours doing an excision surgery and get paid the same as someone who's ablating it and burning it in like 20 minutes. And
right.
that's the difference. So it's not, yes, it doesn't cure it, but it there is definitely worth removing it, because if you do want to have a child, it will at least
Mm.
keep your organs available and functional so that you can get pregnant if you want to.
Okay, I'm glad
Hmm.
you made that differentiation because what I was hearing was, listeners saying, oh, there's no point in trying except to use OCPs. Now, for somebody like myself who's like closed that fertility door, but still has like, sometimes a day where I just need to lie on the couch all day long, maybe OCPs going forward or oral contraceptives would be the way to go
OCP.
forward
Okay.
once I found the right fit. Yeah. Um,
What
and
one more
so
thing,
I
one more
would,
thing, sorry.
oh, go ahead. Yeah, yeah, yeah.
Okay.
Go ahead.
Understanding the difference between OCPs, oral contraceptives, and drugs that put you into menopause are also very different. And, knowing that little bit, because I wouldn't be doing my endometriosis community justice if I didn't explain the difference. So basically, in layman's terms, OCPs kind of, you know, make your body pretend like you're not like you're pregnant, so you're skipping a whole cycle and you can't get pregnant during it. But what happens is it, suppresses hormones at different portions of your cycle. But there are drugs like Lupron or Orlissa, which are funded by companies like pharma, and everyone hates pharma. In this scenario, there are these drugs, they actually put you into menopause. So what does that mean? It's basically like having a oophorectomy without having an oophorectomy. But what happens is a lot of people have bone loss, so they can have fractures. They can get brain fog. They can't remember things. I mean, it really is more detrimental to the body. So for someone like you, I would say yes, OCPs could be helpful, but don't do something that's going to put you into menopause,
No.
especially if you haven't, like, if you are that desperate, if a listener is that desperate and they're in so much pain and you haven't tried OCPs, I would first try OCPs, then maybe try an excision surgery before I would put myself into menopause, especially if I ever wanted children. Does that make sense?
Oh, yeah. Absolutely.
Hmm.
Unnatural menopause. I don't think anybody is promoting that. Like, we want everybody to gracefully age into whatever you're supposed to go into. But for those people who are facing this pain and this problem, or moms of girls who are facing this problem, I just want our ears and our brains full of the information that we need because, this is just around the corner for my daughter. I have, young relatives who have already experienced like, menarche or the onset of their first period. So I'm really interested in knowing what we can do better so that, when these kids have pain, they don't get slapped in the face and told to stand up straight and let's go out to the family party like we grew up having to do. So a lot, did you have a thought?
So, as I said, this has been mind blowing because a lot of the things that you've mentioned, I feel like I never have, I've had all those symptoms. I even actually got ablation done, and it
Oh,
helps with the pain and all the, yeah, it helped with the pain and stuff. But knowing that again, everything's still kind of hazy, right? Like you go in, I think they kind of work out like what does this person fit this symptoms? Does this person fit this symptoms? And it depends also on how sympathetic or empathetic your doctor is to your condition. Going back to it's so wonderful that you're taking this seriously because there's such, it's considered such a woman's disease. It is a woman's disease, but people lack empathy for it because they don't know how to diagnose it and how to treat it. So a follow on to that is, women who are suspecting they have endometriosis, what should they ask the doctors to check for, to now we have this kind of knowledge, what can we do to kind of get a true diagnosis, the correct diagnosis?
So, I mean, to be honest, if you're a woman and you're hearing, oh, okay, I've been hearing in America anyway, the commercials for Orlissa and Lupron, the drugs that I say that put you kind of into menopause, are the ones that are literally, those are the pharma companies that have the money to create awareness and advocacy. Um, so I mean, there are great books you can read. There's a book called Beating Endo, and honestly, anytime I have a patient who thinks, could I have endo? I say, read this book. And no joke, I've had women read it cover to cover in like a weekend and come back to me and say, oh yeah, I had this, those little gray boxes with all my symptoms. That was me writing it basically. Um, and you're still gonna find doctors who are gonna say, no, you can't have endo. I can tell you vignette after vignette of patients that I literally will tell me, oh, I told my doctor, and my doctor said, no, I can't have endo. And they have endo surgery the week later, and the pathology comes back that they have endometriosis. And I'm like this non GYN physiatrist who's walking around telling everyone they have endo. Um, and and it's because I believe people, and I'm asking all the right questions, and I honestly, I wish I could say there is like one thing that you could say to your doctor, but to be honest, you just have to find a doctor who believes your symptoms. And until you do, don't give up and don't take it from them, because um, it's not normal. If you say yes to any of those things, that I vomit on the floor, that I'm literally on the floor, I miss school because of my period, I'm chronically constipated, I look like I'm pregnant. I can clinically tell you you probably have endo, and you don't necessarily
Mm,
need you just have to find now the right doctor. There are definitely a lot of resources like Nancy's Nook for Endometriosis Education on Facebook. There's a Facebook group for it. There's a group, the Endometriosis Summit, and they're constantly holding conferences. There's the book Beating Endo, which is written by Dr. Iris Orbuck, and you can really, I mean, I'm happy to give you more resources than that. But finding, even like when Uzma had sent the original definition for endometriosis, that in itself was wrong because so many websites are just not even bothering to change it.
mhm, mhm.
Right.
I mean,
But well,
all I heard was that it's endometrial tissue that's not supposed to be there, where it's not, it is where it's not supposed to be. And so I was like, how can we, tell women that it's not normal to have these painful, debilitating periods? And so thank you for doing that for us today. So a lot, take it away.
so I am, looking forward to sharing all these, resources. I was writing down beating endo. I think that would be really helpful for our, listeners to understand what kind of, what kind of resources they have. And, honestly, just listening to this podcast, I'm sure it would be a really good start for people who are suspecting it. And I really wish I talked to you maybe 20 years in the past. And it would have
I
definitely
know,
helped
right?
me with some of the symptoms I had. So yeah, I mean,
Yeah.
I wrap it up, Uzma. I think, thank you so much. And it's been really, informative.
No,
Yeah,
I'm
Theba,
I'm
any final
glad I
thoughts
am
before we let you go?
nope, I hope, I see so many women suffering, and when I see the Muslim ones,
Mm,
the only reason I started my social media was so that I could start seeing more Muslim women with endometriosis, because I saw so many Caucasians, a handful of African American or Black women. Um, I very rarely see Spanish speaking women. And I realized that it's not like, oh, it's not less common in our Muslim countries. It's as common. We just have really terrible health care, and these women are not getting diagnosed. And it's a shame. And it like really, it's disturbing. So reach out. There are so many, we didn't even talk about treatments. There's so many things we could do that are not birth control, that are non-opiates, that can actually help
Oh,
people a lot. So I mean, we got to save that for another day, I guess, because there's a
yeah.
ton of treatment options.
Yeah, I'm going to be connecting with you again after this just to get the names of some of those natural supplements that you were talking about, and then maybe some links to treatment protocol that we can include in our show notes, as well as the books that Solat diligently wrote down. And so I'll bug you for those resources so that we can get people, get that information in women's hands and little girls' hands so that they can go to their doctors and say, hey, listen to me. I'm trying to tell you what my body is telling me.
Hmm.
So believe her, hashtag believe her, guys, and believe Thayeba. Dr. Thayeba Ahmed, thank you so much for joining us again today. We so appreciate you.
Thank you so much. All right, good night.